Welcome to this educational video about PTSD and C-PTSD. In this video, we will explore the causes, symptoms, and treatments for both conditions. PTSD and C-PTSD are serious mental health conditions that can have a significant impact on an individual's quality of life. We will discuss the differences between the two conditions, the risk factors for developing them, and the various treatments available. Additionally, we will touch on alternative therapies and the importance of seeking professional help for mental health conditions. We hope that this video will provide you with valuable information and resources to better understand and manage PTSD and C-PTSD. But before we begin, we would like to mention that this video is created for educational purposes only and is not intended to substitute professional diagnosis. If you suspect you or a loved one may have any form of PTSD or any mental health condition, we highly advise you to seek help from a qualified mental health professional. Mental illness is a serious condition that requires professional help, and seeking timely and appropriate care can greatly improve outcomes. Post-traumatic stress disorder, PTSD, is a mental health condition that can develop after an individual experiences or witnesses a traumatic event. Traumatic events can include natural disasters, physical assault, sexual assault, combat, and other events that involve a threat to the individual's life or safety. PTSD is a relatively common mental health condition, with studies estimating that up to 8% of the population may experience PTSD at some point in their lives. Research has also shown that individuals who experience repeated or prolonged trauma, such as military veterans and survivors of childhood abuse, are at an increased risk of developing PTSD. The symptoms of PTSD can vary, but may include flashbacks, intrusive memories, nightmares, hypervigilance, and avoidance of triggers associated with the traumatic event. These symptoms can have a significant impact on an individual's daily life, including their ability to work, socialize, and maintain relationships. Complex post-traumatic stress disorder, C-PTSD, is a similar condition that can also develop after exposure to prolonged and repeated trauma. Examples of trauma that can lead to C-PTSD include childhood abuse, domestic violence, captivity, refugee experiences, and severe medical illness. The primary difference between PTSD and C-PTSD is the nature of the trauma experienced. PTSD typically develops after exposure to a single traumatic event, whereas C-PTSD develops after exposure to prolonged and repeated trauma. In addition to the symptoms of PTSD, C-PTSD includes difficulties with emotional regulation, interpersonal problems, and problems with self-perception. The causes of PTSD and C-PTSD are complex and can include a combination of genetic, biological, and environmental factors. Trauma can cause changes in the brain, including changes in the areas responsible for emotional regulation and memory processing. These changes can contribute to the symptoms of PTSD and C-PTSD. Fortunately, there are effective treatments available for both PTSD and C-PTSD. The most commonly used treatments include psychotherapy, medication, and self-care techniques. Psychotherapy, such as cognitive behavioral therapy, CBT, and eye movement desensitization and reprocessing, EMDR, can help individuals process traumatic memories and learn coping skills to manage symptoms. Medications such as antidepressants can also be helpful in managing symptoms. Self-care techniques such as exercise, mindfulness, and relaxation techniques can also be beneficial in managing symptoms. Studies have also shown that alternative therapies, such as animal-assisted therapy, can be effective in managing symptoms of PTSD and C-PTSD. One study published in the Journal of Traumatic Stress found that animal-assisted therapy was associated with a reduction in symptoms of PTSD and depression among veterans. Another study published in the Journal of Consulting and Clinical Psychology found that cognitive processing therapy, CPT, a form of psychotherapy, was effective in reducing symptoms of PTSD and depression among individuals who had experienced childhood abuse. It is important to note that not all treatments work for everyone, and it is important to work with a mental health professional to determine the best treatment plan for each individual. In conclusion, PTSD and C-PTSD are serious mental health conditions that require professional help for treatment. Effective treatments include psychotherapy, medication, and self-care techniques, as well as alternative therapies such as animal-assisted therapy. Trauma can have a significant impact on an individual's mental health, but with proper treatment and support, it is possible to manage symptoms and improve overall quality of life. Studies have shown that various treatments can be effective in managing symptoms of PTSD and C-PTSD, but it is important to note that more research is needed to better understand the causes of these conditions and to develop more effective treatments. Additionally, early intervention and prevention efforts may help to reduce the likelihood of developing PTSD or C-PTSD following a traumatic event. One study published in the Journal of Trauma and Acute Care Surgery found that early intervention with brief cognitive behavioral therapy, CBT, within 1 month of a traumatic event was associated with a reduced risk of developing PTSD symptoms. Another study published in the Journal of Interpersonal Violence found that childhood abuse prevention programs may be effective in reducing the incidence of C-PTSD among at-risk youth. It is also important to note that access to mental health care can be a barrier to effective treatment for PTSD and C-PTSD. Some individuals may face financial, logistical, or cultural barriers to accessing mental health services. Teletherapy and other remote mental health services may help to address some of these barriers, but more work is needed to ensure that all individuals have access to the mental health care they need. In conclusion, PTSD and C-PTSD are serious mental health conditions that can have a significant impact on an individual's quality of life. Effective treatments are available, but more research is needed to better understand the causes of these conditions and to develop more effective prevention and intervention strategies. It is important to work with a mental health professional to determine the best treatment plan for each individual, and to ensure that all individuals have access to the mental health care they need. If you wish to learn more about PTSD and C-PTSD, we have included a list of resources in the description of this video. These resources may include books, websites, and other materials that can provide further information and support. It is important to note that while self-education can be helpful, it is not a substitute for professional diagnosis and treatment. If you are experiencing symptoms of PTSD or C-PTSD, we highly encourage you to seek help from a qualified mental health professional. Together, you and your mental health provider can develop a treatment plan that best meets your individual needs. If you found this video helpful and informative, we kindly ask that you give us a thumbs up and subscribe to our channel for more helpful content, and don't forget to click the bell icon so you won't miss out on new videos when they become available. Additionally, we welcome your feedback and suggestions for future video topics. If you have a specific topic you would like us to cover, please write it in the comments section. We do read all comments and will do our best to provide information based on your interests. Thank you for your support and interest in our channel.